Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual. And today I have yet another special guest. All my guests are special in one way or another. My friend and colleague, Lexi White. Lexi is a pediatric emergency medicine physician assistant, and I invited her on the show to talk about the role of advanced practice providers, namely physician assistants and nurse practitioners in the pediatric emergency department. Briefly, I will tell you that Lexi is originally from New Jersey. She went to school at St. John's University in New York, majoring in biology. After graduation, she and her husband moved to Florida. She then proceeded to seek her PA degree at Advent Health University, graduating in 2018. And since becoming a PA, Lexi has completed an advanced practice provider residency in emergency medicine. She was a student of mine at that time. She graduated from the program in 2019 and has been working in emergency medicine ever since. She became a pediatric-specific emergency medicine provider in early 2020. Good morning, Lexi. How are you?
I'm great, thank you. How are you doing?
I'm good. I have the day off, so that's always a good day. Lexi, I'd love to hear from you about the challenges that you face specifically as a PA in the pediatric emergency department. And I want to make one thing clear to the listeners. Just so it happens, in my career, I've always worked with PAs. I think in our team, in residency, in fellowship, I've never worked with a nurse practitioner. In our team currently in Orlando, there's only one nurse practitioner. I think everybody else is PAs. I don't make the distinction. For me, an advanced practice provider, APP is an APP. I don't necessarily know what their background is, but I do refer to APPs as PAs because that's just what I'm used to. Lexi, you happen to be a PA, but again, I know there are NPs out there that work just as well. I think in some states, NPs are more popular than PAs and vice versa. But I'd love to hear from you, Lexi, about the challenges as you specifically as an advanced practice provider, happen to be a PA, the challenges that you face in the pediatric emergency department.
Of course. So I do work with a lot of nurse practitioners, and I think in the emergency department setting, we do a lot of the same things. There's not really a definitive distinction.
I agree.
But I think my main challenge comes with being a newer PA in a medical field full of chief complaints spanning all body systems. We see patients with skin, ENT, GI, neuro, plenty of other complaints, and it can be hard to keep up. But at the same time, this challenge is what makes me enjoy my job the most.
I agree with all the above. I think that's one of the things that attracted me to be a pediatric emergency physician is that I didn't want to specialize in one body system. I wanted to kind of stay a generalist and see ENT, skin, pulmonology problems. So I agree with you. I like that, but I can definitely see why that is a challenge.
And I chose ER so that I can see everything and not to bind myself to one specialty, especially early on in my career. We never know what we are going to get. For example, I recently had a child with the chief complaint of rash who turned out to have MASC and gradually became hypotensive while in the ED. I also recently had an infant who came in with a shortness of breath who actually exhibited symptoms of acute opioid ingestion and needed Narcan. Now, I know this is far from the majority of patients that we see. However, it can be difficult to keep a broad differential diagnosis, especially when I do not have as much training as a physician. I am very much aware of this, but I don't think that this makes me or any other nurse practitioner or PA less capable of taking care of patients. Something a very smart doctor taught me is to know what you don't know.
I couldn't agree more. I think that applies to us physicians just as well. And I actually teach that to my kids all the time. You don't know what you don't know.
And That's why your kids are so smart.
Thanks. Lexi knows my kids, by the way. So
I do. We're all good friends. But because I am a newer PA, and perhaps I will always feel this way, I have a low threshold to get my attending involved in difficult patients. One challenge I face every so often in the general ED, not necessarily our group of physicians in the pediatric ED, is some attendings are less likely to help or intervene if I had a question regarding a tricky patient. The most frustrating answer I can receive when I have a question is, do what you want, I trust you. I know the intention is to boost my confidence, but it really doesn't help me learn or become a better PA. I think my role in the pediatric ED is to be an extension of my attending physician. And though I love the autonomy of my job, I also love to learn. It can be difficult to prove myself as a competent medical provider, yet at the same time, I have the humility to ask questions when necessary. I really am lucky to have such a great group of doctors that we work with.
Well, thank you for that, Lexi. That's a great point, and it's good to hear. It's actually very good feedback for us attending who work with the PAs and the NPs. I think one of the reasons I like having you guys is that first, you guys are very helpful. You see a lot of patients, you help us move, and at the same time, you give me the opportunity to teach, which I love. Now, let me ask you, Lexi. Again, I work with many PAs and some NPs, and often find them extremely helpful. Again, they see a lot of patients, they have the flow, and I guess in my head, in my mind, I have the description of the perfect APP, the perfect PA, the perfect NP, someone I would love to have every shift with. I want to ask you, Lexi, in your mind, what is the perfect attending to work with in the PZR?
There are really two things that come to mind when I think of my perfect physician to work with. That would be an attending who, A, recognizes the worth of an APP, and B, is not too busy for questions. As I mentioned before, I want to learn. I have only about 3 years as a PA thus far. And every shift, I want to walk away with something I learned, which will make me a better PA for the patients I see tomorrow. I know I can be wrong, hopefully not gravely wrong. But for example, I may think a blistering rash on a well-appearing infant's mouth may be concerning. This is when I call on my ideal attending. I present my patient, tell them my physical exam findings, and explain my concerns. We have a little conversation involving certain differential diagnoses, and then they see the patient with me. They acknowledge my concerns and make me feel validated for getting them involved in the patient's case. They explain why they do not think the patient warrants a further workup at this time and suggest that's possibly a bad case of impetigo. My attending recommends I call the patient during tomorrow's shift to follow up and ensure the patient's rash is improving. As with every patient, we explain to the parent that if anything gets worse, to please bring them back to the ED. And this is something that actually happened a few months ago. And though I felt silly for overthinking a potentially simple diagnosis of impetigo, my attending did not make me feel incompetent for getting them involved. I had never seen such a severe case of impetigo in such a young infant, but now I have. And my attending was 100% correct. I followed up with my patient's mother in the morning, and the infant's rash had drastically improved in 24 hours. And guess what? Next time I see a similar presentation, I will know what to do. My ideal attending does not belittle me for being a PA instead of a physician. They are aware of the benefits that I bring to the ED. And most importantly, they are willing and able to take 3 minutes from their busy shift running around the ED to answer a question. Now your own. You mentioned your perfect APP. I talked about my quote unquote perfect physician that I'd like to work with during my shifts. But what are the qualities you hope for in every PA or NP that you work with?
So, well, that's a very good question. Let me just respond to your comment and your little story. That's exactly why I teach the residents, and I guess you guys, and I talk about it in the podcast. But one of my biggest rules is to be a good physician, and I guess you can say to be a good clinician, you got to see a lot of patients. So now you're never gonna forget, like you said, a case of bad impetigo because you see a lot of patients, and you get the feel of what it looks like, and you're never gonna go wrong again. So that's great. It's a good story.
Absolutely. Thank you.
Yeah, you're welcome. Well, to answer your question, first let me just respond to your story by saying what you just told us is a good example of PEM rule number 47, which I discussed in episode 11. The way to become an expert in your field is to see a lot of patients. And that goes to a physician, that goes for a PA and an NP. I could not agree more with everything you just said. And to answer your question, it's a great question. I think of my APP really the way I think of my senior residents. I love working with hard-working people who seek every opportunity to learn. And that's really to see patients. To me, that's what it means. And I love working with people who are also curious and want to learn. And since rule number 47 says the way to become an expert in your field is to see a lot of patients, Those are the kind of people I want to work with. I like working with APP who, like me, see a lot of patients and seek every opportunity to learn. And I like what you said. I guess that's a good way to put it in words. I like working with APPs who are trying to be or extensions of my work. I also like APP who step outside of their comfort zone. Again, like residents, I remind them that sicker kids are easier to manage. And as an APP who always has supervision, I think it is best to see the sickest kids so you get experience and comfortable with acute serious presentation, just like you did in your story. I think that help you guys get rid of the stigma of APP, take care of the mild, not sick patients and the low acuity. I think us as physicians don't necessarily need to do the hard work. You guys can do everything else just like us. As with any other colleagues, of course, I enjoy having good teamwork and someone who likes to help, someone who's just good to work with. Now, because I have some obsession with teaching and I really enjoy it, I also like to work with APP who ask me questions, challenge me, forcing me to use my teaching skills. I think it helps both parties become better at what they do. And again, just to kind of summarize it, I like working with an APP who serves or works like a senior resident.
I couldn't agree more. I love it when I work with a physician who challenges me, not necessarily in the way of degrading me or pimping me throughout a shift, but rather by encouraging me to see more critical patients and supporting me when it may be my first time seeing a certain presentation. I really do think it benefits all of us. I become more knowledgeable, you become more confident in my abilities, our ED is then more efficient, and our patients are well taken care of.
Yeah, no, I agree completely. My last question to you, Lexi, and I think that's something that a lot of APPs struggle with, is how do you feel and how do you reconcile the mom or the dad or the caregiver who says something like, well, you're just a PA, can I please see the doctor? Or something to that extent. How do you reconcile, how do you feel about those issues, those conversations?
So, especially in the ER, this doesn't happen nearly as often as I thought it would when I first started. When it does happen, though, what I say usually does not sway parents' minds. I start off by advising them I'd be happy to take care of their child. I'm qualified to take care of their child. However, if they would like to see a doctor, it will prolong their wait in the ED. I have probed a couple of parents or patients for reasons why they do not want to see a PA or a nurse practitioner. And unfortunately, it's usually because of a poor experience with a prior APP. I try not to take it personally. I try to explain that not all PAs, doctors, and Ps are the same, and they should be open-minded to allowing another APP care for their child.
All right, that's a very good point. I think we should always maybe might be helpful in those situations to be reminded of one of the other PEM rules I talk to my residents about is always take the high road even when it seems ridiculous. It's not necessarily personal, it is what it is, you just kind of move on. And I'm sure that can be a very frustrating experience, but I do want to tell you that recently while I was consenting a family for a lumbar puncture that I had to do for a patient, the father asked me if I will do the procedure, and when I said, yeah, I'm going to be doing the procedure, he expressed disappointment, and he said something to the extent, well, actually, I thought it's going to be done by the specialist. Just that's kind of an interesting response. So I hope you also follow rule number 43, which means always take the high road, even when it seems ridiculous. It's not personal. I think he thought there's some kind of specialist for lumbar puncture, and I'm not the one. It's okay. Just kind of explain. So yeah, those are a very very good point. Thank you very much, Lexi.
Thank
I
you.
guess I guess I'll see you at work probably sometime next week, if not
Sounds
sooner.
great. I'll be there.
All right. Thank you, guys. And again, a little disclaimer for our listeners. I do want to say that I view PAs and NP in exactly the same way. Historically, I've never really worked with NPs except for once or twice. Again, just I think one of our team members is an NP, everybody else is PAs. But I really view you guys as equal, and I've had great experience. I think there's some shifts where without Lexi being there, it would have been a big mess. So I always like working with you guys. I like teaching you guys, and I certainly learn from you guys just as well. Thank you, Lexi, very much.
We like working with you too. Thank you.
Have a great day. That is it for today, guys. Thank you very much for listening. I hope you check the website and submit any feedback you have. I hope to hear from you guys soon. Hope you like Aerosmith. Have a good day.